with very high mortality and poor prognosis. The risk of rebleeding is highest in the first 2 to 12 hours. Nearly 50% of those rebleeds are going to occur within 6 hours from symptom onset. And 3 interventions that might reduce the risk of rebleeding include blood pressure control, early treatment of the aneurysm, and antifibrinolytic therapy when someone cannot be treated early on. There is general agreement that hypertension should be controlled after an aneurysmal subarachnoid hemorrhage until the aneurysm is treated. But blood pressure parameters have really not been well defined. So the 2 societies came up with their recommendations, and that is the management of blood pressure control to reduce the risk of rebleeding the suggested is less than 160 millimeters of mercury systolic blood pressure. They note that modest elevation in blood pressure where the MAPs stay below 110 probably do not need therapy, and you want to avoid hypotension in these patients. Now, rebleeding is thought to be caused by dissolving of the clot at the original site of rupture, much like that patient with the basilar apex aneurysm. Antifibrinolytic therapy that reduces the activity was introduced as a treatment for reducing rebleeding. However, early studies showed higher rates of complications, and so the current recommendations, despite a significant adequate findings in the literature, are that patients with unavoidable delay in obliteration of the aneurysm, these may be patients that are too hemodynamically unstable from cardiac issues, or their lack being at a center where they can be treated. So if there's some delay to treatment and there's a significant risk of rebleeding, and there's no medical contraindication, short-term therapy with these antifibrinolytics are suggested for less than 72 hours. And it's reasonable in these patients to make sure that you're looking for DVTs. You want to make sure that they don't have risk for thromboembolic complications if you are going to use the medication, and you want to discontinue it 2 hours before any planned endovascular procedure because of the increased risk of thrombotic complications. Now, seizures are pretty uncommon.